The spread of the virus is not slowing down.
Case numbers will continue to grow for several weeks before reaching a peak and then declining.
About 9% of Canberrans being tested are now returning positive results.
This is a common and consistent story across other jurisdictions in Australia and reflects the rapidly increasing transmission within the communities.
Most people are picking up the virus at social gatherings, and that's where authorities will focus their efforts. From midnight, the terms close and casual contact will disappear. Instead, there will be 4 new categories, and it's up to the individual to identify which they belong to. For household contacts, a 7-day quarantine and testing is still mandatory. High-risk exposures, those are people who have spent a long time with a positive case, for example on a long car ride, are recommended to get tested and quarantined for 7 days, but they don't have to. A moderate risk exposure is when people spend some time near a positive case, like having dinner at their home. They're being asked to take a rapid antigen test and then another 6 days after the exposure. Anyone who's a low-risk exposure, that's people who've spent just a brief time with a positive case, are being asked to monitor for symptoms. Positive cases are also being told to notify those they've been in contact with.
We need you to let other people know around you if you have received a positive COVID test or if they have been exposed to COVID. We won't be able to continue to do this for everybody.
The new classifications should relieve pressure on testing clinics, which were once again at capacity today. But the availability of rapid antigen tests is still patchy, with guaranteed supply weeks away.
The next few weeks will be challenging. This is not the first time, however, that we have faced a difficult period.
Administering booster shots and vaccinating children under 12 is the priority.
Around 60,000 people, or about 16% of those aged 12 plus, have now had 3 doses of a vaccine.
The mass vaccination hub near Canberra Airport will reopen from January 24 to boost capacity. The way hospitals deal with the virus is also changing. COVID-positive people seeking treatment for a different illness or injury will no longer be isolated, and most patients will be required to wear a mask.
I want to reassure Canberrans that in making these changes, the focus remains on keeping hospitals functioning well and ensuring that they are safe for all patients and staff.
A system bracing for a rise in admissions amid increasing COVID case numbers. Holly Tregenza, ABC News, Canberra.